Welcome to ASA TV. I'm Ed Highland. The Anesthesiology Annual Meeting is a chance to celebrate the professionalism of the industry and also to offer pause on what's most important.
Respect is not an entitlement. Respect must be earned.
The Emory A. Rovenstein Lecture is an opportunity to learn from experienced voices about maintaining the highest professional standards. But Dr. David Chestnut's message was that while practicing the core competencies is essential, we must never forget the patient or the people with whom we work.
Consistently exhibiting professionalism is a practiced skill. Professionalism requires lifelong learning and practice.
As ASA leads the industry through the still moving target of MACRA, there is growing interest in other options to MIPS under MACRA rules. This presentation looked at PFPMs, or physician-focused payment models. Could the challenges be worth it in the long run?
They'd be more difficult to set up, but much easier to manage going forward with much higher payments associated with them. So I think that from the standpoint, if I had one thought to share, would be, engage, educate yourself, assess your current situation to see, are you positioned for the frame shift change that is coming to your world, like it or not.
The ICU is a high-risk environment with patients at risk from multiple hospital-acquired conditions. In the Fair-Helrich lecture, the focus was on how doing less can be more help to the patient. Rather than relying on new technologies, harm reductions can be had using simple common sense as well as care and teamwork.
If we can prevent these things, shorten the ICU length of stay, prevent the physical disability, there are tremendous savings to be had.
ASA created the PSH, or perioperative surgical home, as a way to help meet the demand for value, patient satisfaction, and cost savings. In this session, academic, community, and pediatric organizations explained their success with the model. Boston Children's Hospital embraced the PSH with a unique commitment.
We actually changed all of the pre-op clinic signs to the perioperative care coordination clinic. And that is an indication to all of our patients, our practitioners, our surgeons, that we're really just not in the business of doing pre-op evaluation, but we're doing integrated, coordinated care for children throughout the entire episode of care.
There is a lot of information out there about how to treat one patient at a time for various injuries or illnesses, but there is not as much data when it comes to treating mass casualties. Procedures that work for one patient or limited number of patients often may not be used in mass casualty situations. Hospitals can also encounter a lack of equipment, supplies, or personnel. It's important to develop a plan, prepare staff, evaluate resources and equipment, and practice your plan annually. Physician anesthesiologists can find themselves in a leadership role managing response teams.
An anesthesiologist has to perform more than anesthesia type of functions in a mass casualty because there is a shortage of providers. So you are providing not only anesthesia care, you are providing probably the entire care for the patient. And the patient will probably have multiple issues, multiple injuries, and there are multiple patients like that. And as a result, you have to be very thorough with a lot of patients, and that is not easy to do in a very short period of time that's usually available.
The recurring theme when you're dealing with mass casualties is it's a completely random event that could occur at any hospital or any institution in the entire United States. Nobody is immune to the possibility of a mass casualty effect.
A checklist for trauma anesthesia can be found on ASA's website. Just look under Resources from ASA committees. The need for better disposal of opioids was one of the challenges raised during a session on opioids and adolescents. Often, too much is prescribed, with 40% of prescribed opioids being used, while virtually none of the medication is properly disposed of. Instead, they are stored in common areas of the home where anyone can access them.
Actually, most of the children or adult prescribed opioid does not use all the prescription, and more than 90% of the prescribed opioid being left over and can be exposed for dangerous because it's mainly stored in the kitchen or in the bathroom.
Prescription medicines are now the most commonly abused drugs among 12 and 13-year-olds. Speakers encouraged a closer look at guidelines for prescribing, dispensing, and disposing of opioids. This week, attendees have immersed themselves in the latest services and technologies here in the Connection Center.
I mean, it's always cool to go see new airway management techniques, different monitoring devices. Probably as a resident for me, the ability to see different book vendors, different journals, and kind of get different resources for board prep is always a great resource.
The amount of the CME they give you is unbeatable. So you cannot get but the money for that.
You get all of the world experts, not just US experts, presenting information that's up to date, and you get to see all the latest toys and trinkets at the trade display, which is huge. Always learn something from it.
For ASA TV, I'm Ed Hyland.